Hi, I'm Dr. Teresa Sievers, and I'm here today with a wonderful chiropractor, colleague, and friend, Dr. Stohler. And as part of the show, I feel it's extremely important that we bring on the concept of chiropractic because people don't really know what chiropractic medicine is, and they fear it because they don't know what it is. And I just think that what he has to offer is so unique that I just had to share it with you. So without any further ado, I'd like to introduce Dr. Stohler. And
Thank you.
Thank you. Thanks for being on the show. So why don't we start off with just telling us, what is chiropractic medicine? Because people are hearing the wrong thing from their MDs and their DOs. Maybe not their DOs. The DOs may support it, may not. But let's hear from a chiropractor who's been trained and educated and what it is.
Well, chiropractic is the field of health. It's the second largest actual field of health in the world that its premise is that disease comes from illness or dis-ease in the body. So
Okay.
it's been holistic before holistic was cool.
Yeah.
And their premise is that the body heals itself, and that if you put the right things in and everything and the nerves are controlling how the system is regulated, then you'll have health.
And this is interesting because, a lot of times I talk to patients about, they're having aches and pains. I'm like, have you thought about seeing a chiropractor? Oh, no, I don't want to have that painful adjustment, or I'm afraid of that. And while obviously adjustments are a big part of what you do, I found that one of the things that really sets you apart from other chiropractor is you do more than adjust. And, not all chiropractors do that. So I would imagine you didn't start off doing that. Okay, so how did you make that leap from what we would call traditional chiropractic medicine to more of a functional chiropractic type medicine?
Yeah, I found that chiropractic somewhat pigeonholed themselves as a profession by just talking about spinal nerve interference and not really actually incorporating it into the whole body,
Yes.
per se. And even though you might find some chiropractors that would work with the knees or the feet or the shoulders or the elbows, there hasn't been as much of putting it all together. It's interesting how you have physical therapy, chiropractic, and naturopathy, and a lot of these body massage therapy and exercise, but really almost all needs to be integrated together, in my opinion, as body workers.
To get wellness, to get to wellness.
To get that wellness, because just adjustments, which have been shown by numerous studies, work great for acute back pain, neck pain, headaches, but they start to lose the value after about 4 to 8 weeks. So then going on from there, well, where is that other benefit so that we don't just keep stepping on that acute pain? Well, that comes into exercise. Now that tells us what kind of exercise. And the beauty of these things blended together is just like there's different prescriptions of medicine for different conditions or different vitamins for different conditions, certain exercises are better for certain problems than other ones. And so really exercise is medicine.
Interesting. I love it. And I love you've got a whole theme and motto, and I'd like you to actually say it because it really encompasses all of that.
So our motto at Fundamental Health Solutions is think right, eat right, move right, live right. And so that came about after reading the Blue Zones book and how when they broke down those 9 powerful habits that people kept healthy with, as we broke that down, we found that 5 of them were spiritual, emotional, thoughtful habits. 4 of them were, or 3 of them were related to food, and actually 1 of them was related to exercise and movement. And so that's what really became important to me. The think right was, okay, well, where is my patient at? A lot of people sometimes get put off because when it comes in to say, well, is this right for me? Well, for me, it depends. And some people get frustrated, well, what do you mean it depends? Well, it depends on the person you are, whether
Right.
the treatment is right for you.
That's right. And I just want to pause there because that's why we're doing this show, folks, is because what's right for one patient may not be right for another, because if you look at people who have spontaneous healing or do wellness, they go with their intuition to some level. And I wanted to just elaborate because a lot of people don't know what the blue zones are. The blue zones are 5 areas in the world where people are living well into their hundreds, and they've been studied now, and they're looking at why are these people living to be 100? What are they doing? And it's not just what they're eating, as Dr. Stohler said. So he's been having a big movement going on here in Southwest Florida because I think your goal is to kind of make this area a blue zone.
Yeah.
Yeah.
Yeah. The blue zone is really this where people live the longest and are the healthiest, and it's all based on their habits and how they live their life. As we know from the Danish studies and about genetics and epigenetics, that it's almost 70-80% of what we do and how we do it, and it's about 20% of who our parents were.
Yeah, I actually think it's even less. I think it might even be as little as 5%. But the bottom line is, people can no longer use this excuse, well, everybody in my family had arthritis, so I'm going to get arthritis, or I'm going to have my hip replaced, or I'm going to have bone loss. So just in a quick summary, I come to see you, I'm a middle-aged female, and I'm suffering from migraines. You're going to do some adjustments on me, but what else might you do for me?
Yep. So as you come in, we sit down, and of course, it's like any medical profession. We sit and have a dialogue, and we go over your past history, medical history, those kinds of things. But really what I'm asking or trying to find it is, where are you as a person?
And where you're wanting to be.
And where do you want to go?
And what are you willing to do to get there?
And what are you willing to do to get there?
And that's what's really important, because people tend to go doctor, whether it's a chiropractor or an MD or even a holistic, practitioner, and they're looking for them to make them well. When really that person that they're seeing is there to give you the tools to help yourself get well.
That's so true. When they come into my office, I literally will tell them on the first visit,
hey,
I say, you came in with your problem, you're going to leave with your problem. But in the time that we're here together, we're going to work on your problem. Now, where do you want to work?
Yeah, what areas are you willing to make change? I know what you need to do, but I need to know where you're willing to be.
And sometimes they're willing to work at a place that might be easier or may not be the primary part or might be not where I want to work, but that's their starting point. And see, what I like is that most of this healing and dysfunction is emotional based. Yes. It's not about knowledge. That's why I think sometimes doctors have a hard time, because they come from a knowledge situation. They say, well, we know this is right, do this. But they don't take into the fact that that person has a lot of emotional, spiritual stuff that connect to that. And it's not easy to just change that. Behavior modification can be difficult, and it really takes time. I've waited 3 years for someone to do a cleanse before. Every time they come in, I just plant the seed.
When you're ready, I'm here.
And then they finally come in 3 years, they go, now I'm ready.
Well, the irony is, I've actually referred patients to you, and I had a patient that many years I wanted to do the cleanse, and she resisted me, and then she comes in one day, she said, I did Dr. I said, I don't care who you did it with, I'm so grateful you did it, and she felt wonderful. So there you have it, folks. It's another way of healing, but ultimately you're healing yourself. If you'd like more information about Dr. Steven Stohler, you can find him on the internet at www.fitdocs.com.